Hello, welcome to another post from Dr. Blake's Healing Soul. Today Aphrodite, our athletic trainer, here at St. Francis Hospital, will discuss the principles of self-management of scars.
Okay, so the main thing after surgery is you want to make sure that you're breaking up the scar tissue caused by the surgery incision here to increase mobility in that area. So typically when the patient comes into the clinic, we'll start off with some type of deep heat. So we use ultrasound here, or we can use a heat pack and just put it on that area for about 10, if it's a heat pack, for about 10 minutes. If it's ultrasound, we'll usually go about 5 minutes because it's a deeper heat. And when the patient does it at home, they use a heat pack, and then I ask them to get in there with their fingers to make sure they're breaking up that scar tissue. So you can either go in a cross-frictional pattern, so you're going to go in like a horizontal direction over the scar. You can also do circular motions all the way up and down the scar, so as tolerated by the patient. You can also, if the area is really sore, you can use ice massage. So it would be the same concept. You would go cross-frictional. You could also do circular. And for ice massage, we usually go anywhere from 5 to 7 minutes. And each minute you get progressively more intense because the area will numb up, so the patient will be able to tolerate more pressure over the area. So at home, heat pack, make sure the patient gets in there if they can tolerate it with their thumb or finger. And you can also use ice massage. If they feel really sore after the ice massage, they can end it with just putting a heat pack over the area. A cold pack over the area for about 10 minutes, just to kind of calm down the area.
Great, Aphrodite. And what are there products that they can purchase online that help with scars?
Yes, there's one product called Dr. Blaine's Scar Kit, but there are also various products out there that the patient can purchase to help break down the scar tissue. A lot of those contain like little gel packs, or has vitamin E in it, just to kind of soften the area so that it's easier to break down the scar tissue around the scar.
Great. And why, just to emphasize again, why do you do cross-frictional massage versus massaging along the line of the scar?
You just want to break down any unnecessary scar tissue that builds up around it to, again, increase mobility in that area. So you don't want to go along the actual scar, you want to go around so that you're breaking up the scar tissue around it. So that's why you would go across and in circular motions.
So some scar is good.
Yeah, the actual scar itself of the surgery is okay. So that's why we prevent going from along the scar that way, because that's okay to have. We want to break up the scar tissue around it.
Great. Thank you very much, Aphrodite.
You're welcome.